Hi, my name is Gabby and I'm going to be your student nurse today. I just washed my hands and I was going to start off with a cardio and peripheral vascular system assessment. Is that okay?
Yep.
Do you have any chest pain?
No.
Do you have any shortness of breath?
No.
And do you have any leg pain or cramps?
No.
Okay. I'm going to get started with taking your blood pressure if that's okay.
Sure.
There we go. Does that feel comfortable?
Yes.
Turn your arm like this. Clip this here. And I'm going to feel for your brachial pulse. Okay. Alright, it's about 110/64. Take this off.
Okay.
Alright, second off, I'm going to be palpitating your pulses.
Okay.
So you have a pulse. I'm going to do your left arm. You have a brachial pulse, which is in the inner elbow. You have a radial pulse, which is in the inner wrist. You have a femoral pulse, which is on your groin, but I won't do that for privacy issues right now.
Okay.
You also have a popliteal, which is on, you want to straighten your leg,
Okay.
which is on the back side of your knee. You have a posterior tibial, which is on the inside of your ankle. And then you have a dorsalis pedis, which is on the top of your foot. And all are regular and 2+.
Okay.
Now I'm going to be palpitating and osculating your carotid artery.
Okay.
And that is right here. That is a 2+ as well. Now I'm going to be checking for bruit, which is I'm going to take my stethoscope and put it right here on your carotid artery, and then I'm going to have you take in a big breath and hold it for 10 seconds.
Okay.
Okay, deep breath. And hold. Okay, there's no sign of bruit. Now I'm going to be osculating and palpitating your pericardium. And your pericardium is the sac that is around your heart. Okay, now I'm going to be osculating it. So I'm just going to put my stethoscope right on it and listen for 30 seconds. Normally I would go under your shirt, but for privacy issues, I'll just keep it above. Okay, your apical pulse was 62 beats per minute. Now I'm going to be checking the color and temperature of your skin on your arms and legs. So, your skin color is a tan. It is all even on your arms and both of your legs. I'm going to be checking the temperature with the backs of my hands, making sure the temperature is even on both. Okay. One second. Okay. Now I'm going to making sure that the color distribution is even on both as well. And now the hair distribution. It's even on both. I'm going to check for edema in your ankles and your feet. No edema, which is good. And now I'm going to have you lay on your back, please.
Okay.
And I'm going to lay on your back, and I'm going to lift your knee up, and I'm going to push it back. Does this hurt at all?
No.
Okay, good. And that was testing the Homans syndrome, and you don't have it, so it is negative, so that is good. I'm also going to be checking your capillary refill, which is where I pinch one of your fingers and make sure that it comes back. Okay, and that was immediate, which is good. So now I'm going to be osculating your heart sounds.
Okay.
So we have ape to man. We have the aortic, which is in the second right intercostal space. Pulmonic, which is in the second left intercostal space. We have the Erb's point, which is in the third left intercostal space. We have the tricuspid, which is in the mid-sternum line. And then we have the mitral, which is in the left mid-clavicular fifth intercostal space. So I'm going to be listening to all 5 of those. Good, and all of those sound regular, which is good.
Okay.
And now I'm going to listen to your S1 and S2 sounds. The S1 sound is best heard at the apex of the heart, then the S2 sound is best heard at the base of the heart.
Okay.
And that is just checking to see if you have any heart murmurs.
Okay.
So I'll be listening for that. And those sounds were regular, and I did not hear any murmurs.
Okay.
And that completes your assessment for today. Thank you.
Thank you.